Hi, my name is Jerry Nunn from Nunn Better Health and Wellness, and this is the podcast or season 1 for Nunn Better Health and Wellness. I've been a director of pharmacy for over 30 years, primarily hospital pharmacy, director of pharmacy, 3 hospital system in Fort Myers, Florida, director of pharmacy of a 2 hospital system in Naples, Florida, director of pharmacy of a teaching hospital up in Philadelphia, and now I'm in with the CBD and wanted to be able to talk to you a little about how CBD works, how the different questions I have as far as from the different patients, and also a final brush up with regards to my history. I do have a cannabis certification from an accredited university. I'm the only one in Florida that, as a pharmacist, that has the cannabis certification from an accredited university, not just an online 1-day, 2-day seminar. And then I'm also a licensed pharmacist, and I'm also a licensed consultant pharmacist. I also have a certification in pharmacogenomics with the gene processing, and I'm also a member of the Florida Hemp Council in the state of Florida, which helped with the regards to the new Senate Bill 1020 for the state of Florida with regards to how they're actually working with the new CBD guidelines for Florida. What I'd like to start with is I have a lot of common questions that come in, people that come into my office or to my store rather, and so I wanted to read off some of those and then answer them because this is kind of a repeat. Everyone seems to have these types of questions. The first one, will I feel high after taking a dose of CBD? And the answer to that is no. It's a very big myth. Everybody thinks, oh, it's marijuana. It's going to get me high. I don't want to do it. The biggest thing with CBD is, by law, you can only have up to 0.3% THC. And the normal dosing with medical marijuana is 3, 5, 10% THC. It's such a small amount, you won't even know that you're taking it. You're not going to feel any euphoric effect at all with the CBD. And to go a step further, a lot of the products that I have are broad spectrum, which means they do not contain any THC. So you're getting the benefit of all of the CBD and the cannabinoids, but you're not getting any of the THC period. So you're not going to test positive on a drug screen. The next question is, how do I know the quality of the CBD? That is an excellent question. As a pharmacist, I'm all about quality. And the number one way to be able to see the quality of any product is by looking at their what's called a third-party COA, which is a certificate of analysis, which is a lab analysis by a third party. And it's extremely important. Every manufacturer, quality manufacturer, is going to have a certificate of analysis, and they're going to be very proud to display that certificate of analysis on their website. In addition, in the state of Florida, it's required that you have what's called a QR code on your label to where it pulls right to your website, which has the lab analysis on it. It's extremely important. That way you know exactly what's in that product, because that lab analysis, it is what it is. And regardless of what's on the label, you just cannot do that. One of the things that happens quite a bit is people come into my store and they say, hey, I bought this product online. It just doesn't seem to be working well for me. I'm not getting the effect. Can you look at it for me and tell me what you think? The first thing that I do is I actually pull it up online on the manufacturer's website, and I look for a certificate of analysis. It is absolutely amazing how many companies they bring their bottles in, and how many of those companies have no certificate of analysis, or you're really struggling just to try to find it somewhere hidden on their website. And also, some of them don't have it at all. We've actually called some of those manufacturers and said, hey, we don't see it on your website, but can you go ahead and email us a copy of the certificate of analysis? And they say, we don't do that. And right there, it tells you that's not a good quality product. First of all, it's not even legal in the state of Florida anymore because of the new hemp bill or Senate Bill 1020, because you have to have that certificate of analysis. Next question is, can I take CBD if I'm on a blood thinner? Well, blood thinners are like Coumadin, warfarin, the Xarelto, Eliquis, Effient, those are all what I call serious blood thinners. And you will know if you're on one because there's a reason. There's different reasons for having your blood to be thinned so that it doesn't clot. The challenge with the blood thinners are they have a very narrow therapeutic index. And with that narrow therapeutic index, just the smallest change can make a big difference in your bleeding times to whether you don't bleed enough or you bleed too much. And you could have a cerebral bleed or even a GI bleed and end up in the hospital. So it's critical with those drugs because they're metabolized 100% through the liver, and CBD is 100% metabolized through the liver. There's a drug-drug interaction. With that interaction, it absolutely, the way that it's working, they're both fighting for metabolism in the liver, and the CBD apparently seems to be winning because you're getting higher blood levels of the blood thinners. And I have done it for many patients to where I'm having to turn them down and said, until there's a study that says you're taking 5 milligrams of Eliquis and you're taking 50 milligrams of CBD, how much do you need to adjust your dose of Eliquis or how much do you need to adjust your dose of CBD to where you're not having an issue with bleeding times? That study's not out there. And so I tell those patients, benefits do not outweigh the risk. And it's significant. It just does not outweigh the risk, so it's not worth it. And that's for the oral form that goes internally, whether it's an oil internally, whether it's a gummy, whether it's a capsule, all of those that are systemically absorbed, those are the ones that have a problem. The topical, really there's minimal absorption topically, so it's not an issue, but internally it's a significant issue. The next question. Does it have any drug interactions? And we touched a little bit about this just a second ago. And yes, it's 100% metabolized through the liver, and it's the cytochrome P450 is the area of metabolism. And there's quite a few drugs that have that are metabolized in that same area. The difference is, I give a perfect example, is if you have a cholesterol agent. A lot of people are on statins, which are for helping lower the cholesterol. You'll know it if you're on one. And the thing is, yes, there's a potential interaction. However, it's not a narrow therapeutic index. It's a very broad, and all it's going to do is it may increase a little bit of the effectiveness. It may actually increase the effectiveness of the cholesterol agent to help to control your cholesterol. It's nothing that's going to be dramatic that's going to hurt you. It's real important. But the biggest thing is any drugs that are metabolized through the liver have a potential of having a drug interaction with the CBD, but the ones that you really need to pay attention to, you need to ask your pharmacist, you need to ask your doctor, is what drugs are they, and is there an issue with me taking them? Because the majority of them, it's not an issue. Blood thinners is a serious issue, and I absolutely, just based off of previous experience, I would not recommend internal CBD with someone taking the serious blood thinners like that. Aspirin's fine. A lot of people take low-dose aspirin, but the serious blood thinners, absolutely not. Next question is, this is interesting. I have a lot of people that come in and they said, I want the CBD that treats diabetes. And so I had a patient come in the other day and said, I have so-and-so who's a friend of mine that has diabetes, and they said that they started taking the CBD and now they don't have diabetes anymore. I want the CBD that treats diabetes. And I said, there's not one. I said, what could be happening is that what happens a lot is the CBD is very, very good for a lot of people for stress. If you're able to reduce stress, you're able to reduce a lot of things like blood pressure and diabetes. Here's the reason why. Think about it. So many people, when they're under stress, they eat more. It's called stress eating. So if you're stress eating, you're eating all the wrong stuff, and therefore your blood sugars go up. If you're taking the CBD and you're able to control that stress better with the CBD, then your blood sugars don't go up. I can absolutely see where that would be a benefit. However, CBD is not a diabetes medication, but there's a lot of people that do use it because it is beneficial, because it helps to reduce their stress. And exactly the same thing with the next one is to treat blood pressure. people come in and they say, hey, I want the CBD that treats blood pressure. Exact same principle. The principle is that with the CBD is it helps to control the stress in the body, and therefore, if a lot of times people that have certain blood pressure issues, in the morning when they take the blood pressure, they're fine, they're normal, but once they get out into the workforce or they're driving down the highway, they start getting stressed in work, then their blood pressure starts going up. So I have over 100 patients right now that absolutely are taking it specifically to help control their blood pressure, even though it's not a blood pressure medication. And I can't emphasize that enough. It is not a blood pressure medication. However, it works to help to reduce stress. So if your blood pressure is associated with stress-induced blood pressure, then the CBD will absolutely help with that. And again, the people that are on it, they really swear by it that without that CBD, their blood pressure would not be under control. But I have to again reinforce, it's based off the stress, not based off that it doesn't slow the heart rate down, it doesn't dilate the vessels, it doesn't do anything like a normal blood pressure medication. It just helps to reduce the stress at this point based off the studies that we know about. Next question is, how quickly will I feel better? Well, again, a couple of things. One is, again, when you take it, it's not like you're going to get a big hit off of some type of marijuana joint to where you get a high. You're never going to feel this euphoric aspect anytime with the CBD. It doesn't happen. It doesn't have the one products that I sell primarily do not have any THC, but even the ones that are legally available that only have up to 0.3% THC, you're not going to feel any type of high or euphoria. The way that it works as far as with stress, usually within 48 to 72 hours, you're going to notice a significant difference in stress. A lot of people say that it actually helps them to sleep, not that it knocks them out like an Ambien does, but that it helps to relax them. So like you come home at night, you got all these things on your mind. You've got this list of things that has to be done the next day. You got to pay bills. You got to go see the grandkids next week, whatever. And the CBD helps to lower that down to where it kind of calms down your mind about thinking about all that, which allows you to rest. If you're able to rest, to relax rather, then it allows you to be able to sleep better. So it's very good for that. But with the stress, it absolutely, I would say 24 to 72 hours, you can see a difference in your reductive stress. As far as arthritic pain, a lot of patients, and this is all based off of what patients are telling me, is that when they take it, that it takes longer for it to build up in the system. Me personally, I have a bad knee. It's bone on bone. I need a knee replacement. It literally took about 2.5 to 3 weeks before I really noticed the full effect of the product working to get absorbed and really working with the arthritis in my knee to help reduce that inflammation. And you have to think about it. If you've had this arthritis, didn't get developed in one day, so it's going to take longer than a day to be able to get it addressed. So if you're going to take CBD and you're wanting it for serious arthritic pain in the knees or the back or the neck or the hands, don't take it for 5 days and say, it doesn't work. It's just know in the back of your mind, it's going to take 2 to 3 weeks before you get the full effect of it. Some people get it much quicker, but on average, it's 2 to 3 weeks to really get the full effect of the CBD. Another question. Can I overdose on CBD taking 200 milligrams a day? 200 milligrams a day sounds like a high dose. I mean, most people taking, even for arthritic pain, is about 50 milligrams a day. However, one of the drugs that are FDA approved, there's one drug that's 100% CBD that is FDA approved on the market, but it's only approved for 2 specific disease states, and they're both seizure disorders. One of them is called the Lennox-Gastaut syndrome, and the other one's Dravet's syndrome. Both of those seizure disorders are in pediatrics. They are very, very serious. Some of the kids, you're talking about 30, 40, 50-pound kiddos, and they literally could seize every 2 minutes, which think about it. You have no life if you're seizing every 2 minutes. So they started the massive study. It was a pretty significant study. I think it was 600 patients, and they started this study. Long story short, at the end of the study, these kiddos, 30, 40, 50-pound kiddos, are taking up to 1,000 milligrams a day of the CBD. So you think, wow, well, when I saw that, when I was reading the study, I said, okay, so what's the side effects? What kind of side effects are you going to have when you're taking 1,000 milligrams of CBD a day? Well, really the number one side effect is with that large a dose, it does cause drowsiness. And so the kiddos were lethargic and when drowsy. So what they did, they were taking it once a day because it really is a once-a-day drug. The half-life on it is somewhere between 30 to 50 hours. It's a very long half-life, so it really is a once-a-day drug. However, they started taking it twice a day to be able to help reduce those side effects, and after 3 to 5 days, they were able to get over the drowsiness of that. And they did check their liver enzymes because it's 100% metabolized through the liver, so they checked those to make sure there wasn't any issue. And out of all the people that were there, they didn't have to discontinue the product based off of any liver issues. It did increase the liver enzymes slightly, but it was never enough to discontinue the product itself, the CBD, during the study. The good news, how did it affect those kids, and why is it FDA approved? Here's the thing. Think of a kiddo. They're seizing every 2 minutes. They have no life. The family taking care of them have no life. And now we're able to change that. This CBD was able to change that to where they were literally only seizing about once or twice a week. So from every 2 minutes to once or twice a week, it's life-changing. Life-changing for the child, life-changing for the family. And so it's very significant. I kind of went off on a tangent there because that just shows you that 1,000 milligrams a day, it's not an overdose. I don't recommend it. But for those kiddos, that's what it took to be able to control their seizures. So taking a 200 milligram a day dose is not going to be detrimental. You may get a little bit more drowsy than you normally would with a 50 milligram dose. However, you're not going to have some dramatic overdose. I have patients that are taking up to 400 milligrams a day currently. They were on serious opioids. One of the patients were taking 60 milligrams of morphine 3 times a day. So that's 180 milligrams of morphine a day. And then over a 3-month period, we were able to reduce that down. Obviously, with the physician's help, writing the right prescriptions and stuff, we were able to reduce them down to 15 milligrams once a day. So going from 180 milligrams of morphine a day down to 15 milligrams of morphine a day, dramatic difference with very, very good pain relief with the CBD at the higher dosing. And that's significant because you don't get the side effects. You don't get all the constipation. You don't get the respiratory issues. You don't get the addiction aspects with the CBD that you would get with the opioids. So it's very, very dramatic, and it's a big deal. One of the other questions I have, or I've been asked of me quite a bit, is I have bad kidneys. Can I take CBD? It's an excellent question because as we get older, our renal functions tend to go down, and there's a lot more issues, especially with ibuprofen and Aleve that are 100% metabolized through the kidneys, and it's hard on the kidneys. The good news is CBD is 100% metabolized through the liver, and since it's metabolized through the liver, there's no issue with the kidney whatsoever. Next question, can CBD help me sleep? The answer is yes, but it's not a sleeping medication. It's not like an Ambien. It's not going to knock you out. It may, in the higher doses, it may make you a little drowsy, which would be a benefit. However, again, what it mainly does is it helps to decrease your stress. It helps to reduce all these things, like, again, when you're coming home at night, you think of all these things you got to do the next day, and you just can't shut it off. And it's like you're laying in bed and you're thinking about all these things. You just can't shut it off to go to sleep. The CBD allows you to bring all that down to help you relax. You're able to relax. It helps you to be able to sleep. That's the way that it works. Next thing, what is the best way to take CBD? This is an excellent question. Again, how's the best way to take CBD? there's a lot of people out there that take gummies. There's a lot of people that take capsules. There's a lot of people that take the oil. The information on the oil is always taken sublingually under the tongue. So you have a dropper and you put the CBD under the tongue. Say, why would you do that? Why don't you just swallow it? Why don't you put it in a drink and then just drink it? Here's the reason why. If you were having chest pain and you were going to the cardiologist, or you call the cardiologist, say, hey, I'm having some chest pain. The cardiologist is going to tell you, take some nitroglycerin. The key to remember, though, is he's not going to tell you to swallow a tablet. He's going to tell you to put that tablet under the tongue sublingually. And the reason is because it gets absorbed directly into the bloodstream. And if it gets directly into the bloodstream, it's going to work a lot faster because you don't have an hour and a half for that chest pain to go away. You want it to go away as quickly as possible. That's why they do it sublingually. Exact same principle with the CBD oil is that when you do it sublingually, it gets absorbed straight into the bloodstream and is able to be effective. The second thing that's beneficial when you're doing it sublingually versus when you're taking a capsule or a gummy is that it bypasses the first pass effect. And say, well, what the heck is the first pass effect? The first pass effect is where when you swallow the tablet or the gummy or the capsule, it goes into the GI tract. One of the things is it's going to be fighting for digestion into the small intestine with the food that you have in your stomach. So the more food you have in your stomach, then the less potential for absorption into the GI tract. The second thing is once it gets absorbed into the GI tract, the percentage that does get absorbed into the GI tract, it goes straight into the liver before it goes throughout the body. And when it goes to the liver, it metabolizes. And just as an example, this is not scientific, but when it goes into the liver, it metabolizes. And so if you're taking a 50 milligram dose, maybe that makes it a 40 or a 45 milligram dose. So the bottom line is it's a lesser dose than what you started with because it goes through that first pass effect. And that's exactly the same reason with the nitroglycerin is you want the full effect of the nitroglycerin, so you take it sublingually. Well, to get the best full effect of the CBD, you want to take it sublingually as well, so it goes straight into the bloodstream, bypasses the liver, and you bypass that first pass effect, and you get much more bioavailability in the body for it to work. So the best way, as far as without smoking it, is going to be under the tongue sublingually. As a healthcare professional, I'm just have challenges being able to promote any type of smoking inhalation of the products. It's just it kind of goes against my belief as a healthcare professional. Even though there's a lot of people that do it, that's not the recommendation that I would take. Would be sublingually under the tongue. Another question: how often do I need to take CBD? Another very good question. And there's all sorts of information on the internet. The internet can be great. The internet can be dangerous. There's some places that say, oh yeah, I take it 3 or 4 times a day. Well, again, from a clinical pharmacokinetic basis, factual basis, and looking at the study of the CBD, which is called Epidiolex, that was approved by the FDA for those seizures, the half-life of the drug is about 50 hours. Some studies say it's 30 hours, but regardless, it's much greater than 24 hours, which 24 hours is a day. So it's 30 to 50 hours is the half-life of the product. There's no way that you need to take it more than once a day, and it's still going to be in your body after 24 hours. So it's a once-a-day product. However, there's a lot of people that take it differently, but from a true pharmacokinetic basis, based off of the volume of distribution, based off the half-life of the product, it is a once-a-day drug. And so you could take it in the morning, or you can take it in the evening before you go to bed. I have people that take it both ways. I take it in the morning, and it's great. It helps my knee. I don't have any drowsiness, but it's very, very beneficial. I just take it once a day. And again, under the tongue, you hold it for 60 seconds. So you put the dropper, you put the dose under your tongue. You hold it for 60 seconds under the tongue. Then you swallow. One of the things I add on top of that is don't drink anything for 5 minutes. After 5 minutes, you can do whatever you want. And a lot of people like to drink it. They said it's a little bit dryness in the back of their throat. However, 1 minute under the tongue, and then don't drink anything for 5 minutes. It helps to keep any residual that you have under your tongue. It helps to keep that absorption going for another 5 minutes, so you get the best bioavailability possible. So again, I can't emphasize enough, 1 minute under the tongue, then you swallow. Don't drink anything for 5 minutes. After 5 minutes, you can do whatever you want. And some of my patients absolutely like to drink a glass of water because they said it does have a little bit of dryness in the back of their throat. For me, it doesn't do anything, but for a lot of people, it does. Okay, next question. If I use the CBD roll-on for my back, will it help my anxiety? Will it help my shoulder pain? That's an outstanding question. I have a very strong CBD roll-on. It's 3,000 milligrams. It's absolutely the strongest on the market, strongest in the nation. Again, it's not 300, it's not 500, it's not 600, it's not even 1,500. It's 3,000 milligrams of CBD in a roll-on form. It looks just like a dial antiperspirant. You roll it on. You don't get any on your hands. You roll it exactly where you want it. It has a little bit of alcohol in it, so it dries in 3 to 5 minutes. So you can put it on, and 3 to 5 minutes later, you can go to bed, and you don't have to worry about it getting it all over your sheets. But all the time in my office, I have people come in, and they have serious back pain. I roll this on their lower back, and I'm literally rolling it over scars of some of this surgeries they've had. So they may have 3 or 4 scars based off the surgeries they've had on their back, and they're still having major issues. I roll the CBD on their back, and it does, after about 20 to 30 minutes, give them pretty significant relief. It's amazing how well it works. And I love to do that to show them that it's going to help them, not just sell them the product, but I absolutely want them to try it. Let me put it on their back, show them how to apply it, and then be able to see them have the benefit of the product. But one of the questions they have, and it's a great question, is, okay, you just put this all over my back, my lower back. Okay, is that going to help my stress? Is that going to help my shoulder pain? Is that going to help my knee pain? And the answer is no. One of the things with the topical roll-on is it does not get systemically absorbed to any great extent at all. It's not going to really be absorbed systemically. It's not going to interfere with your anticoagulant medications. It's not going to interfere with really anything systemically. It's not going to help with your stress. It's not going to help with your shoulder if I put it on your back. If you have issues with your shoulder, you need to put it on your shoulder. It only works in that area. The one thing that I do is I call it good margins. It's like if you're in surgery, you want to have good margins when you're cutting out a tumor. You want to make sure you have good margins to make sure you get all that tumor. You want to have good margins when you're rolling that on, to not just put it on the exact site that hurts, but put it all over around that area to make sure that you get all of the tendons and the ligaments, the musculature area, and the skeletal area in that area. That really helps to make sure you get the full impact of the product. A couple of other things with regards to some people have asked is, as far as, okay, how is it made? How do you make this stuff? Because I've heard several different ways to make it. One of the things is it's the extraction process. First of all, you have the hemp product, and you have the leaves, you have the flower, you have the stems, the stalk, and that's the part of the product that you actually use in what's called an extraction process. So it's called the biomass, and you put that through an extractor, which is the one we use. It's called a supercritical CO2 extraction process. And that's the gold standard in the industry. It's the cleanest process. It gets the cleanest product that you can get. Also, that tastes a lot better. It doesn't have all the other stuff in it because it's very clean. But it's absolutely the best, the highest quality standard that you can get. It's absolutely the gold standard in the industry. Supercritical CO2 extraction. And that really cleans up the product itself. Now, one of the other things is you hear a lot on, not on the news, you read a lot when you go on the different websites and they have hemp oil. If you go on Amazon.com and you put in CBD oil, you don't get CBD oil. When you search for it, you get hemp oil. And hemp oil is not the same as CBD oil. And actually, in Florida, the legal definition of CBD oil is called hemp extract. and it's real important, hemp extract is not the same as hemp oil extract. So hemp extract is CBD. Hemp oil, the way that's derived is from the seeds of the hemp plant. Think of the hemp plant having seeds just like sunflower seeds. If you think of a big deal of sunflower seeds, think of a big deal of hemp seeds, the same type of concept, to where you take those seeds, and what they do is they cold press those seeds into hemp oil. So just like olive oils, you get the olive, you cold press it, and it makes olive oil. You take the hemp seeds, you cold press it, and you get hemp oil. But here's the thing. Hemp oil and the seeds of the hemp plant do not contain CBD. They have all sorts of good antioxidants. So it'd be like taking fish oil. It'd be like taking vitamin E. Good antioxidants, and it's healthy for you. However, it does not contain CBD. It's critical to understand that. Hemp oil does not equate to CBD. Hemp oil is an antioxidant. It's a good product, as is vitamin E, as is fish oil, but it's not CBD. The hemp extract that we use, again, it comes from the supercritical CO2 extraction. That's where you get your CBD products. When you extract it, you get an isolate and a distillate. You get CBD isolate, and you have a distillate that has the small amounts of THC, less than 0.3%, and the other cannabinoids. And then the magic happens when we bring it to the other manufacturing plant, to where you mix the isolate with the different parts of the distillate to be able to make the perfect CBD product that you want to present. And also it helps a tremendous amount, that supercritical CO2 extraction, of the taste of the product. There's another product that's alcohol extracted, and the alcohol extraction, it's a very good process. It's been around for a long time, but it's truly, you're using a food grade ethyl alcohol to be able to extract the CBD out of the product. It's just not as clean a process. It's not as pure a process as the supercritical CO2 extraction. The next thing is they're saying, how do I know that I'm getting a good product? Well, there's something called a third-party lab analysis. It's called a COA, Certificate of Analysis, which is a lab analysis. And on this lab analysis, it's a third party, which is a key word. Third party means it has nothing to do with the company that's making the CBD. They actually have to send it out to someone else that has no ties to the company, so that it's a true third party, and it's a true lab analysis, a complete lab analysis of the product. And in Florida, you have to have what's called a full panel COA. And what that is it tests for herbicides, it tests for pesticides, residual solvents, it tests for heavy metals like lead and arsenic, and it also tests for fungus and bacteria, and to make sure that it's really a clean product, because unfortunately, the way that the hemp grows is it actually absorbs the bad nutrients in the ground. And so you got to make sure that you're in clean soil so that you get a clean product. If not, you could have all sorts of lead or arsenic in that product because it's coming right out of the ground into the plant, into your product. And in the state of Florida, they're very strict about that with the new Senate Bill 1020, the hemp bill. And it's dramatic, and it makes a very much higher quality product. That certificate of analysis is required in the state of Florida. And again, it doesn't just test, does it have CBD, how much CBD is in it, does it have THC, how much THC is in it, but it also does the full panel of testing, again, for the herbicides, the pesticides, the residual solvents, the heavy metals, the fungus, and the bacteria. It's a complete panel. It's expensive. It's about $500 per lab test. Well, think about it. $500 per lab test, if you got 20 products, that adds up pretty quick. And guess what? It's batch specific. So every time you make another batch, then you're going to have to do another lab analysis so that you know that that batch that you tested that's the batch number that's on the bottle, and that's what that certificate analysis goes to. Here in the past, I've seen some lab analysis that were back from like January of 2018. They have a lab analysis up there, but it's from January of 2018, and it's not batch specific. So what does that mean? That means that the product you have in your hand, you have no idea if it's related to that certificate of analysis that you're looking at on the screen or not, because there's no batch related to it. All you know is that they did an analysis of a product. You just don't know if it's the product that you have in your hand. And also that goes hand in hand as far as the THC. Does it contain THC? That's the euphoric, the product that causes euphoria or can cause euphoria, which is like in the medical marijuana. Well, again, CBD by law can only have up to 0.3% THC. And medical marijuana usually is 1, 3, 5, 10%, 15% THC. It's completely different. So if you're looking at on average a 5 to 10% THC with medical marijuana, and you're having CBD with 0.3%, is practically nothing. However, it's a very critical thing to understand is just because it's a small amount, THC is very lipophilic. And what that means is it absorbs into the fat cells, so it gets absorbed into the body and it stays there. So the more that you take, if you take it every single day, even that small amount of THC, if you take it every day, you're not going to test positive for THC on a drug screen the first month, but in 6 months, you could build up enough in your system to where it could test positive. And if you're trying to have a job and you get tested, random drug screening, it's not worth being able to test positive and then you lose a job because you're testing positive for a drug screen test. It makes no sense. So if you're in that, I do a lot with law enforcement. I do a lot with the hospital and schools. Cannot test positive. So that certificate analysis to show how much THC is in there to make sure there's not any THC. And I highly recommend if you're in law enforcement and some of these places that are very, very strict on THC, don't take the chance. If you're in other areas where they understand and they know the commonality of using the product, they know you're on CBD, it may not be an issue. They may understand it. They do a drug screen and test positive, maybe just test positive for a very, very small amount, knowing that you're on CBD with THC in it versus being on medical marijuana, we have a much higher level of THC in the system. Okay. Here's one, and I already talked about it a little bit. As far as the difference between hemp extract and hemp oil. And I talked a little bit about that. Again, the hemp seed oil comes from the seeds of the plant, and the seeds of the plant have no CBD in it. You cold press those seeds and you make hemp oil, just like you cold press olives and you make olive oil. Same thing. They're both good antioxidants, just like fish oil and vitamin E, but they do not have CBD in it. They are, however, they're used the hemp oil itself. In a lot of companies, they use the hemp oil for the carrier agent. And what does that mean? Well, when they extract it and you have the isolate of the CBD, as an example, it's a powder form. And so you need a carrier agent to be able to dissolve it and be able to have it to make the bottle of the 30 ml bottle, because the whole 30 ml bottle is not of CBD. It's a diluted process to where it has some powder form of the CBD, and then it has a carrier agent in it. Well, that carrier agent for a lot of companies is hemp oil, and that's fine. It's a good antioxidant. It's good. However, the taste of that lacks a lot to be desired for a lot of people. And in addition to that, hemp oil is not as well absorbed in the body as some of the other products. One of the products that we use in ours is called MCT oil, which is coconut oil. Coconut oil is superior in absorption into the body over the hemp oil. That's why we use it. It also has much more desirable taste, and I have a lot more comments that it's much more desirable to be able to take versus the one that has the hemp oil in it from other companies. One of the other questions I have that's been asked quite a bit is, with this new Florida law that's came out, again, it's the Senate Bill 1020. It was actually signed by Governor DeSantis back in June of 2019. Went into effect officially July of 2019. However, as far as it truly getting all the rules and regulations processed and being official, January 2nd of 2020 is when it went into full effect. With that, there's several things that you have to have. One of the things is you have to have that certificate of analysis. It has to be available on your website. The second thing is on your labeling. Your labeling is completely changed based off of what most people had on there. There's a lot of different things on the labeling. I don't go through a lot of detail, but bottom line is you have to have what's called a QR code. Most people are familiar with that, to where the QR code on the bottle, you scan it, and it goes right to your website, and it will allow you to go right to the lab analysis to show exactly what's in that bottle, batch specific. And so that's really important. The second thing is there's certain labeling that has to be on there that's very specific. You have to have labeling as far as that it contains no more than 0.3% of delta-9 THC on a dry weight basis. There's several things as far as you have to have it in 30 mLs and also 1 ounce. There's multiple different things on the labeling, but you also have to clearly to say that it's hemp extract, and with the hemp extract, that means it contains this much CBD per bottle and also this much CBD per dose or per serving. That has to be spelled out on the label. And there's a lot of things on there. But the biggest thing is the QR code and that it gets connected to the lab analysis or the COA at the website, and it has to be batch specific. One of the last things with the Senate Bill 1020 for the state of Florida is that every place that sells CBD, whether it's online or not, if it's in the state of Florida, you have to have what they call a hemp food license. There's a lot of gas stations and stuff that have a food license because they sell the deli products and the drinks and everything like that. However, in the state of Florida, they have classified CBD as a food product, and what they've done as a step further is you have to have a hemp food license, which is by the Department of Agriculture. So they have to come into your store, be able to certify everything that you're doing, do a full inspection, and the first thing to do when they walk in the door is they grab a bottle and they look at it, see if it has a QR code on it and some of the other things that are required by law, but the QR code is key. Does it have a QR code? Does it have a batch number? Does it have an expiration date? Then they get their phone, they scan that QR code, they make sure that it goes to a website, they make sure that that website has a certificate of analysis that's a full panel COA that contains more than just does it have CBD and does it have THC in it, but it has all the other things with the heavy metals and the pesticides and things. They go through that. That's the first thing they do when they walk in the door. If you don't pass that, they don't need to go any further because you're so far out of compliance that they don't need to go any further. But then they look at the storage, they look at the bathroom facilities, things like that. There's a lot of things into it. Bottom line is you have to have a hemp food license, regardless of whether you're selling it on site or if you're selling it online. And I know that sounds a little bit challenging, but the reality is if you're in the state of Florida and you're selling, even if you don't have any products at all, that you're purely selling it online and it's going to someplace else in Texas as an example, and then they ship it out to you, you still have to, by the way the law is written, to have a hemp food license. And it's very important to remember that. One of the things I'd like to do now is actually kind of go over some of the products that I have that I talked about. One of the big ones is my roll-on. And the roll-on itself, there's a couple of roll-ons I have. I have a 3,000 milligram roll-on, and I've also have one that's even stronger. It's a 5,000 milligram with an added product of 1,000 milligrams of CBG. These things are beasts. They're absolutely absolutely the strongest in the nation. There's nothing you can look online. Nothing is this strong in a topical roll-on. 3,000 milligrams, absolutely strongest in the nation. And then I went a step above that and made a 5,000. But in addition to the 5,000 milligram roll-on, it also has 1,000 milligrams of CBG. And I may talk about that here in a second. But I was going to show you on the roll-on, it's just a roll-on, just like a dial antiperspirant. And you roll it on, and it comes out, it dries in 3 to 5 minutes, you're done. And what I love about it is when you're putting it on, you have nothing on your hands. Versus a lot of people have a balm that is kind of like a Vaseline. They have a balm and they get it out of the jar, they put it on their back as an example, and then they have it all over their hands. They have to wash their hands. Well, when you wash your hands, guess what? You're washing off all that expensive medication right down the sink. And then in addition to that, that balm does not dry. Well, if it's not going to dry and you're about to crawl into bed in the sheets, guess what's going to get all over your sheets? That's why this has been such a popular item. In addition to the 3,000 milligrams is absolutely amazing with the amount of help that is given so many people. Now, in addition to that, I have this other roll-on. Again, it's just like the other one. It's a dial antiperspirant roll-on. However, it has 5,000 milligrams of the CBD, and it's also full spectrum, which means it does have a little bit of THC, less than 0.3% for sure, probably closer to about a 0.1% THC. But in addition to that, it also has 1,000 milligrams of CBG. G as in girl, CBG. CBG is one of the newer ones that they've been talking about. It's actually called the mother of all cannabinoids. And the reason is because everything starts in the process on the hemp plant with CBG when it's growing, and then it converts. There's enzymes that convert from CBG. You have your CBG here, and then it converts it with enzyme down to CBD. It converts it enzyme down to THC. So all the THC and the CBD are all from CBG. They're doing a lot of studies right now with CBG in the cancer institutes as a perfect example. There's a tremendous amount of studies that are going on right now. They're not published because they're not finished, and there's not a lot of patients in it. But there's a lot of cancer institutes that are showing very good promise with CBG. Well, what I've done is I've put the CBG in this bottle for a couple things, hopefully to be able to potentially be able to help with someone that has possible some skin cancer to be able to use this. Is it going to work? There's no clinical evidence absolutely that it's going to absolutely that's published that is absolutely going to help with skin cancer. However, I'm trying to be on the bleeding edge, not just the leading edge, but the bleeding edge of trying to get this product out there. There's nothing else like it on the market. There's nothing that has 5,000 milligrams of roll-on. There's nothing out there that has 1,000 milligrams of CBG in it combined in a roll-on on the market anywhere. There's a lot of products out there that's in the oil that has 2 milligrams of CBG in it, but nothing that has 1,000 milligrams of CBG. It's significant. It's a game changer. One of the other products I have that's along that same lines is I also have the oil. And the oil, this is the one that you put under your tongue that we were talking about, where you hold it for 1 minute under the tongue, you swallow, don't drink anything for 5 minutes, and then after that, you can have glass water if you want to wash it down, as far as some people have dryness in the back of their throat. The big thing with this product is, again, it's 5,000 milligrams of CBD. There's a lot of products that have 5,000 milligrams. This is 5,000 milligrams. It's also full spectrum, which means that it does have some THC in it. But again, it's less than 0.3%. And in addition to that, it also has that 1,000 milligrams of CBG. And again, that 1,000 milligrams of CBG is absolutely the strongest on the market, is in combination with this amount of CBD. 5,000 milligrams of CBD, 1,000 milligrams of CBG, nothing else like it on the market. And again, they're doing a lot of studies with CBG, and this could really be a game changer in the future. It's significant the way that it works. I use it personally myself I have a knee that I need a knee replacement, so I take this every morning just because it's super potent. I'm able to take it, and I can absolutely notice a big difference as far as the pain level that I have taking this versus just taking normal, just the plain broad spectrum CBG. The broad spectrum CBD. And it's been very, very well received. It's brand new out on the market, and I'm expecting some very big things with it. One of the other things I have is I have a full spectrum, which means it has THC in it, 5,000 milligrams CBD by itself. It's full spectrum, which means it has other cannabinoids in it, but it does not have that mega dose of CBG. It's your normal 5,000 milligram full spectrum CBD. So it does have some THC, but again, it's less than 0.3%, and it's very significant. I also have 3 broad spectrums. The difference between broad spectrum and full spectrum, if it says full spectrum, that means that it has THC. Broad spectrum means it has all the cannabinoids in it, or a lot of the different cannabinoids in it, besides CBD in much smaller quantities, but it has no THC. And so I have some products that absolutely for law enforcement, the school, the hospitals and stuff, people and CDL truck drivers that can't be testing positive for THC, that's the product that they're using is these. I have a 5,000 milligram, I have a 3,000 milligram, and I have a 1,500 milligram. And these are the ones that those people are using, especially law enforcement, so that there's no way they're going to test positive for THC because there's no THC in it. But it is a broad spectrum, so it does have some of the other cannabinoids in it. In addition to that, I have 2 gummies. Some people love gummies. And again, from a bioavailability standpoint, they're not going to be near as bioavailable as the oil. However, there's a lot of people that love gummies, and they primarily use it for stress. They love when they start getting into stress, they can pop a gummy. And a lot of them, I think part of it's placebo effect, but a lot of them think that, in 5 or 10 minutes that they're feeling great. The reality is it's going to take as much an hour and a half for it to actually get absorbed truly 100% into the body. But the difference between these 2 gummies, first of all, it's 750 milligrams in the bottle. Now, it's a huge concept that so many people walk in and they bring a bottle with them. And say it says 750 milligrams like this. And they say, well, how much are you taking? And they said, well, I'm taking 750 milligrams. I said, no. I said, that's what's in the bottle, but how much are you taking? No, I'm taking 750 milligrams every day. And it's a really hard concept to understand. But with CBD, when it says 750 milligrams on the bottle, that's how much is in the entire bottle, not what the dose is. Each dose, you have to divide it by the quantity in the bottle. So there's 750 milligrams total divided by 30 gummies. That's going to be 25 milligrams per gummy. And by Florida law, that's spelled out on the bottle itself. It says 30 pieces, 25 milligrams per dose or per piece. And it has to be labeled on the bottle. Now, the other thing, if you notice on these 2, one says full spectrum, which means it has THC in it. Again, not any more than 0.3%, and it's labeled with a little green labeling there. And then the other one is broad spectrum, which does not have the little lime green labeling on it, so therefore it does not have THC. They look almost identical. However, their difference is that one has THC as a full spectrum, the other one does not. It has the other cannabinoids because it's broad spectrum, but no THC in it. This is Jerry Nunn. Thank you so much for listening to the podcast. Again, Jerry Nunn, Nunn Better Health and Wellness. We have our website at nunnbetterhealth.com, and feel free to look and see all of our products there. Anything that you need, please give us a call. It was great talking with you guys, and I hope you enjoyed the podcast.